I'm Jen Mall, and welcome to Nurse Connect. I am an RN and a board-certified nurse coach. I believe that connecting with others is essential to living a happy and fulfilled life, and that sharing our stories not only helps us to heal ourselves, but also helps others by inspiring hope and optimism. I am so grateful to share stories of these incredible nurses on their journey, and I encourage you to find a way to share yours too. Thanks for listening in. Hey everyone, we'll jump onto this week's podcast in just a moment. But real quick, if you're a nurse coach or a leader and are interested in developing a hospital-based nurse coaching and wellness program, then I would love for you to join me in my Facebook group, Hospital-Based Nurse Coaching and Wellness Programs. In this group, we share best practices and resources, as well as trainings to help you develop a successful program, which will decrease turnover and burnout, as well as increase employee satisfaction. Of course, we know this leads to decreased serious safety events and improved patient experience. I have got a free mini course that I can send you to get started on this journey. I will drop the link below, and I hope to see you inside the group. Have a great day. Bye. Hi, everybody. Welcome back to Nurse Connect podcast. I'm Jen Mall, and I'm really happy to have Savannah here with me. Welcome.
Thank you so much for having me.
Yeah, absolutely. We connected through a mutual friend who I think Michaela is actually your roommate, right? Yeah. Oh, I just love her. She's got a podcast and she did her virtual nurse career day, and it was awesome. And when I was hearing you chat, I was like, oh, I can't wait to have you on my podcast too.
And that was such a fun event.
It
I'm
was.
excited for next year's already.
Same,
for this
same.
year, I guess now it's 2024.
Same. I was like, oh, I hope I get an invite back. That was so much fun just to be around so many different nurses and hear about all the different career paths. And it was really awesome.
Yes, for sure.
Very cool. But we're here to talk about you today. So please take us back. How did you become a nurse? I'd love to hear your journey to where you're at now as a nurse practitioner.
Yeah. So my story is very unique in the sense that it was a kind of an indirect path. I grew up with my parents both in healthcare. My dad was a psychiatrist and my mom was a labor and delivery nurse. And actually watching their hours and the burnout, I actually told myself I'll never be in healthcare, which is kind of funny because look where I am now.
Yeah.
But I also saw how much passion they had for what they did.
Yeah.
And I never, they loved their work. They spoke so highly of, the medical system and their patients. And I could tell that their hearts were so in what they did.
Yeah.
But as a teenager and as a child, it's kind of like you don't really envy the night shifts or the 24-hour shifts. And no part of you is like, oh yeah, I want to do that. So when I went off to college, I was just very open. But I did have an affinity for like health and wellness. I found myself even in high school gravitating towards like yoga as a, extracurricular / elective, and like Ayurvedic medicine. I had a teacher who hosted like a little class at Ayurveda. And I found myself just like interested in these like alternate modalities of health. So when I got my way into college, my college, University of Georgia, actually didn't have a direct nursing program on campus. So you would have had to transfer out. And what 19 or 20-year-old wants to leave all of their friends in undergrad? Like no one. So I actually landed in a major called health promotion and behavior.
Oh, interesting.
What's really cool is I feel like now as a nurse practitioner, that's what sets me apart.
Yes.
Health promotion and behavior, you took a bunch of classes, you were required to have anatomy and chem and bio and the basic sciences, but you took a lot of like psychology and human behavior theory. So like what motivates people to change?
Yes.
How do their minds work? What helps them, make the shift from one way of thinking to another? And that felt really powerful because it helped me realize, we go down one path for so long and oftentimes we'll feel stuck, and it's how do we pivot?
Yes.
And so that major in the context of health made me realize that I wanted to help in health and wellness on a broader scale.
Wow.
So then it was like, well, how do I use this?
Yeah.
Like I graduated with this, it was a bachelor's in science and health promotion and behavior. And it was kind of like, okay,
what do I do now?
Yeah, what do I do now? Like I have this skill set. I learned all these different modalities, but how do I put this into practice? And
Mm-hmm.
I'm not clinical.
Mm-hmm.
Yeah. So
Yeah,
like,
that is fascinating. So how did you, I mean, because like, right, I think I too went down a path of many different degrees and ideas and things. And it's like, but how do you really put that into practice? Like, how do you make a job from it? So then how did you shift from there? Is that when you went into nursing?
yeah, so it was like my senior year of college, and
Hmm.
I was trying to decide, what comes next? Is it a master's in public health? Like, do I
Okay.
just stay in like the kind of greater outer branches of
Okay.
health and wellness, or do I want to go down into the weeds and work on an individual level? And the truth was, I still didn't know.
Okay.
And I felt like nursing at the time, truly, it was just this is a way to get my foot in the clinical door and figure out what comes next. I still didn't
Yes.
know. Even as I applied to nursing school, I still wasn't like, oh, yes, I'm 100%
Yeah.
sure this is what I want. So I applied to an accelerated bachelor's of nursing. So it was a second bachelor's degree. It was 15 months at Emory University. And I piggybacked that about 8 months after I graduated undergrad.
Wow.
So that's kind of, it was kind of this 2-for-1. And I could feel the difference even in nursing school with the way that I approached things and how I thought
Hmm.
about things because of that undergrad degree.
Yes. Oh, that's fascinating. I didn't even know that was a type of study, but it makes so much sense because those are the things that we struggle with as clinicians is helping people to shift their mindset and their behaviors and their choices. And that's really cool to hear that there actually is a program for that because it's so needed.
Yeah, I mean, it's super, super cool. It's just like in isolation, it's so
Yeah.
hard because most of like the implementation and the
Hmm.
employment is like on the grand scale, like public health
Yeah.
departments and things
Okay.
like that. And I'm such a people person that I was like, I don't want to sit behind a computer and like
Yeah.
create or like do research full
Hmm.
time,
Yeah.
Um, and yeah, in nursing school, even that was when I was like, I realized I wanted to find a way to marry the worlds.
Okay. Yes, that makes sense. So how did you do that?
So universe was kind of like, oh, you don't know? Here, let's put this really difficult chronic illness in your lap that you have
Oh
to
my
navigate.
God.
So I got really sick when I was like 23.
Oh my gosh.
And no Western medicine provider could figure out what was wrong with me. It was like bouncing from doctor to doctor, like severe GI distress and pain, bloating, constipation. Like I would belch like I had a 12-pack of beer and I just like had eaten nothing for a day. I
Wow.
lost a bunch of weight. I was absolutely miserable, anxiety through the roof.
Hmm.
Went to Mayo Clinic for a week, all of the invasive testing, and they just said, you have dysmotility, broad term,
Yeah.
and your enteric nervous system or your digestive system just kind of stopped working. And it's what they call idiopathic, meaning we don't
I
know
don't
what
know.
or how.
Oh,
And in that moment, it was almost like I felt so much despair. As a 23-year-old does, I was down in the
right.
forums, I was on Reddit, I was on support groups for like motility and gastroparesis. I was beside myself.
Right.
And my two Western medicine parents were kind of at a loss too, because that's all we knew.
Yeah.
And that's how I found functional medicine
Mm.
because I got sick and I
Yeah.
was, in nursing school getting all this workup done. And I found myself as a patient at a functional medicine clinic being seen by a nurse practitioner. And they literally saved my life.
Oh my
Yeah.
God, I have chills. So how
Mhm.
did that work? Like what did they do differently, I guess, than traditional Western medicine?
Yeah. So for starters, they spend an hour to 2 hours with you to like learn about your life and your story and all the confounding factors. Unlike Western Med, where
Yeah.
it's like, what happened yesterday? Here's old carts for this specific condition, a
Yeah.
specific symptom. And functional medicine was like, let's dial it back.
Hmm.
What are these pathologies that could have been happening since childhood or birth? And how does this all play this symphony of hormones and intricacies and gut health and toxic load and all this stuff? How could this have possibly gotten you to where you are now?
Wow.
So that perspective really opened doors for me.
Oh, absolutely.
And then as far as testing goes, as you know, Western medicine, it's like necessary blood work that insurance will cover,
Yeah.
right? Based on ICD-10 codes. And functional medicine was like, look, we have access to these functional tests. They're more expensive, like stool tests and hormone urine tests and saliva tests for your adrenals and you name it, they have it. It is expensive, but this is kind of, I was at a loss.
Yeah.
But I said, Mom,
Desperate.
Dad, I'm 23. Will you please pay for this?
Yeah.
And I'm so lucky and so thankful that my parents, even though they didn't fully believe in it, they were willing to help me because on my own, I wouldn't have been able to afford it.
Oh my
Um,
gosh.
but I did a stool test and it came back that I had bacterial overgrowth, fungal overgrowth, candida, dysbiosis. My microbiome was completely out of whack. I mean, so many things that Western medicine would have never even started to detect.
Yeah. Yeah. So then what was your treatment with that?
So I continued to work with Western medicine as well. I found a gastroenterologist. He's a
Oh,
neurogastroenterologist
wow.
at a university in Georgia, and he did a smart pill study. So I swallowed a camera and it like looked at my pH through the gut and transit time and all sorts of really cool stuff.
Yeah.
So I kind of started to marry the two worlds of
Hmm.
through my own journey. Like exactly what I wanted to do for people, I like had to do in myself first
Yourself.
almost. So yeah, I ended up going on an herbal protocol. I did use some pharmaceuticals like nystatin and
Hmm.
fluconazole for fungals.
Hmm.
But for the most part, like rewiring that enteric nervous system, vagus nerve restimulation, utilizing various natural like anti constipation motility support. And it was a slow journey.
Hmm.
And it's not until I stepped into being or becoming a functional NP as a provider that I was able to fully heal myself.
Amazing. And what was that time frame like?
Yeah. So all that workup must have been when I was 23, 24.
Mm-hmm.
And then I worked as a nurse in the ICU, in the neonatal ICU
Oh,
for a
wow.
couple of years. And it was funny. As I worked during that time, I literally would write like supplement plans for my coworkers, even
Yeah.
though I'm like supposed to be
Try
home.
this, do that. Yeah.
Yeah.
Okay, wait. I need to back up though. Like,
Yeah.
how did you end up in the NICU of all places?
I know. I know. So it was, I graduated nursing school and everyone was getting jobs. And
Yeah.
I think I still hadn't found somewhere that felt like home to me.
Yeah.
Especially, I'm like, of course not, because what you do for a living wasn't an option. Just
Yeah.
being a nurse, as much as nursing played an integral role to what I do now,
Yes.
there wasn't a way for me to do what I'm doing.
Right.
So it was like, what is the most right thing, or
Okay.
what felt the most right?
Okay.
And NICU babies, they come into the world and they're missing pieces of their body that are not developed.
Yeah.
Support them. So similarly to an adult that has had a big roadblock or something kind of falling off, these are chronic conditions that need outside the box thinking.
Yeah.
And so there was a physician on our team who was doing research studies on gut microbiomes in neonatal ICU babies and the
Fascinating.
sterility of their guts from being
Yes.
C-section versus vaginal.
Ah,
So there was a lot of like overlap in the research and in the, stability of immune and gut microbiome and how these things play a role in our vitality.
yes.
And I found that fascinating. And so
Yeah.
that's kind of what, allowed me to use that as my entry point into clinical medicine.
Oh my gosh. Okay, that is so fascinating because I would not say I'm clinically like super knowledgeable about NICU and the gut microbiome. I mean, I'm dabbling, right? But I have heard, so that's interesting. Tell me a little bit more, and maybe we're going off on a tangent about that specific population. Like, so if they're born C-section, they don't get the natural flora if they're not born vaginally, and then do they have more chronic conditions? Do they tend to be sicker?
Totally. Yeah. So it's nuanced, right? Because there's so many different
Yeah.
in different causes that an infant winds up in the NICU for. So
Right.
it's really not a one size fits all or a
Sure.
catch all by any means. But even now as an NP, I ask my patients, women, men, 40s, 50s, 60s-year olds, were you vaginal or C-section and were you breastfed or bottle fed?
Really? And you see like a correlation.
Totally. Because think about it. C-sections are sterile. You cut open
Mhm.
and you remove, right? And that is
Mhm.
cool, and we're able to save lives that way. And it's so important. And I'm
Yeah.
so glad we have access to that.
Yeah.
And you are not going through the vaginal canal. So you're not getting inoculated with mom's vaginal microbiome or microflora into your gut. So you're not exposed
Mm.
to those bacteria.
Wow. And then I guess the same with breast milk, right? You're getting mom's stuff through the breast milk versus a sterile formula.
Yeah. So immunoglobulins, colostrum is one of the
Mm.
most healing, modalities we have. We have adults taking colostrum now, bovine
Yeah.
colostrum for hair, for gut health, for skin, to help combat, infection and, inflammation. And so if you think about it, these little babies that are just born, we need colostrum. And
Hmm.
so, in the 80s, 90s, I couldn't even tell you the time frame, but formula was such
Yep.
a
Popular choice. Yeah. I was like, what's the right word for that? Yeah. It was just mainstream. That was what everybody did.
But now we're realizing breast milk is like, in NICU babies, they would use donor breast milk because
Yeah.
moms wouldn't have breast milk come in yet because their
Yeah.
baby was born early. So
Yeah.
we'd use donor milk, so that's how important breast milk is. And it helps you,
Wow.
like, health truly starts from the moment you're born and what you do.
That is so fascinating. Oh my gosh. Okay. So you made your way through NICU and you got into NP school. Did you do a program specifically for NPs in functional medicine?
No, so it was,
Does that exist?
I joke that working in functional medicine as an NP, you're kind of a trailblazer
Yeah.
because, NPs within itself, unlike PAs or MDs, you're picking a tract when you go back to
Okay.
school, right? Like MDs and PAs, like they rotate through all the different things, which is amazing and so thorough. Whereas as an NP, you're saying, I'm committing to pediatrics
Yeah.
or I'm committing to family or midwifery or whatever
Okay.
you choose.
Okay.
So I was trying to be really strategic in my approach. And I debated, do I want to go to medical school? Do I
Yeah.
want to, how do I want to approach this?
Yeah.
But it's so hard because a lot of what they're teaching doesn't apply to what I wanted to do.
Yeah.
So I went the FNP route, the family nurse practitioner route, because I felt like it was the most encompassing.
Okay.
And I knew I wanted to be in outpatient medicine.
Yeah. Yeah.
Right? So I chose that route and I found a program. It's called IFM, the Institute of Functional Medicine. That's a certifying body that Western medicine recognizes for functional training. So I'm currently getting certified through IFM. But all the while, in NP school, again, I'm looking through the lens of my undergraduate degree in human
Yeah.
behavior and through the herbal Eastern kind of functional lens that had healed me. So I'm doing a
Yes.
lot of outside studying, a lot of outside blogs and research and podcasts, and just filling myself up with as much knowledge as I possibly could.
Yeah. Yeah, that is incredible. Can you help me understand the difference between like lifestyle medicine and functional medicine? Are they similar?
That's a great question. So it gets really nuanced because there's like, integrative medicine, functional
Yes.
medicine, lifestyle medicine, who can practice what. So
Yes.
I always tell my patients, I ask them what is functional medicine to you, because
Mm-hmm.
I like to understand kind of where people's minds are at.
Mm-hmm.
The way that I like to describe functional medicine is that it's root cause medicine.
Yes.
So, for example, you come in with headaches as a patient. You're like, I have horrible headaches. I've done everything. I've been to neurologists. I've done Botox. I've tried all these different things. I'm on, Imitrex or whatever, sumatriptan, X amount. I'm sleeping as much as I can, X, Y, Z. I would say, okay, happy to refill your pharmaceutical,
Yeah.
happy to work with your neurologist, send me your imaging, give me all the Western data.
Okay.
And while that's holding up the hood, I'm going to look underneath the hood.
Yeah.
So I'm going to look at, nutrients, micronutrients, heavy metals or mold or toxins that could be,
Yes.
causing the way that, or interrupting the way that your signaling works.
Yeah.
I'm going to look at potentially gut health and see, is there a dysbiosis there? Hormones, what's going on? What are your cycles like? What's your cortisol like? All these things play a role in the way that our body functions. So
Mm-hmm.
I'm looking for root causes as to why you're having those headaches.
That is fascinating and so needed. Is there, I know most of this ends up being out of pocket, right? Because I know, well, it's kind of recognized by Western medicine. The insurance doesn't quite cover this work yet, right?
Yes, and that's the hard part. And like to answer
Yeah.
your question a little bit about lifestyle medicine
Hmm.
too, like that's encompassed in functional. Like you
Okay.
can't necessarily treat someone functionally without integrating lifestyle, whereas
Hmm.
lifestyle by itself might be working on diet, stress, sleep, exercise, but it's not necessarily digging deeper. If that
Okay.
makes sense.
Yes, it
Um,
does. That's helpful.
Whereas I think insurance will cover oftentimes like lifestyle medicine or like working with a physician that does that. Unlike functional medicine, because the insurance model is just not like we're not set up for success
Yeah.
because insurance is trying to get you in and out as many patients as you can. And truly to understand someone's story and really figure out what testing
Yeah.
they need, I need at least 60 minutes. Like that's a
Yeah.
minimum.
Yeah. Oh, that is incredible. And what an absolute blessing for those that you're able to work with because like your experience, right? You tried to do everything the right way and the traditional way, and that didn't work for you. And how disheartening as a young, 20, early 20s person to be chronically ill like that. That's just devastating. And so you found a
Yeah,
way.
it was really hard. And I
Mhm.
think, I learned a lot now being on the other side of it as to like how people are and like their
Yeah.
reactions and how
Yeah.
emotional they can be and volatile. It's like I have a lot of empathy because that was me in so many ways.
Mhm. Yeah. Yeah. Do you at all dig in into like you because you had mentioned some going back to like childhood and asking those questions. Now, do you get into like did you experience trauma as a child? What are some of those like root cause sometimes issues, energetics, emotionally wise, that might be embedded in the system and causing problems?
Yes. So in the
Yeah.
functional medicine model, it's called the matrix. They
Yeah.
break down the systems. And the very last one is mental emotional. And so underneath that's like spirituality,
Yes.
trauma. When I tell all my patients, share, unlike the traditional doctor where you go in and they want just the bare minimum, they want the skinny. I want you to go as in depth, as deep as you feel comfortable. Because the
Yeah.
more data points that I have, the more I can piece things together.
Oh, this is so amazing. And I can think of a couple of situations in my life where, I struggled and figure out, I went to a gastroenterologist. I did an endoscopy, like I did all these things, but I couldn't figure out what this discomfort was in my abdomen, but it was always there. And it took a couple of years. And I think it was really once I started working on my mental emotional work and clearing out some old stuff is that when that pain started going away. And so I was able to kind of in retrospect look back and it was like, okay, that probably was
Totally.
all related.
That gut brain axis is
Yeah.
everything too.
Yeah.
Like the gut brain axis is so real. Gut feeling is rooted in science. 90%
Yes.
of your serotonin is made in your gut. Like gut is the foundation of everything.
Yes. Oh, it's super fascinating. I learned recently that you actually have more innervation in your gut for sending messages to your brain than your brain sends down. I'm not sure if I'm saying that the right way,
Yeah.
but I was like, oh my gosh. So like you said, that gut feeling, like that's legit. The feelings that you feel before sometimes your brain even catches up to process it is incredible.
Totally. Yeah.
Yeah.
It's so important. And I do think that Western medicine is like catching on to some of this stuff. I
Mm-hmm.
really do.
Mm-hmm.
I mean, I'm seeing more and more patients come in with providers who have drawn like B12 and vitamin D
Yeah.
and iron and things that, typically are overlooked. So I think that
Yeah.
there is an inkling of like our world catching on to like how needed this is.
Yeah. Do you find that sometimes well, I mean, I think the answer is yes. You kind of have to be your own advocate, right? Like you have to be like doing your own research and like sometimes informing, unfortunately, your doctor about what kind of tests that, maybe you could start with. So if somebody's really maybe struggling in this season of chronic illness, not sure what's going on, maybe not quite ready to make the jump into paying out of pocket, is there anything that you can suggest that they might start with kind of research wise and I know I'm sure that depends on the type of diagnosis and everything that's going
Totally.
on too, but where do you think people could start to just explore?
Yeah, so I think like honestly, I mean, my dad, the psychiatrist, jokes that I do Nancy Drew medicine. So it's like
Yeah.
to be your own Nancy Drew. I think, start out with thinking about what system is most impacted because
Mm,
all your systems are interconnected, right? Like
yes.
your detox plays a role with your hormones and your gut health. And I mean, all of it's so interrelated. But if you can kind of at least narrow down what system you think is the most
Okay.
compromised. And like if it's autoimmune, I think gut. If it's,
Mm,
to kind of like learn what two things go together. But if you can at least narrow down what system you feel like's the issue,
yeah.
that can at least be a jumping off point for you to start to do research. There are really good kind of leaders in the field, Mark Hyman, Isabella Wentz. I mean, there's so many, depending on, if it's mold, if it's metals, depending on what's going on with you, there's so
Yeah.
many trailblazers and leaders in the field that have put out good books and good articles and so much research. So it's kind of like, I guess, narrowing down what area you think it is and then being open to what the experts in the field have done, like what road they've paved, and being open to trying some of those things.
Oh, that's so helpful and just such an interesting specialty. And I don't even want to say specialty because you're really encompassing the whole human. And that's, I think, so different than what we normally see because like we might get 15 minutes with our doctor, right? And so the fact that you're spending an hour and a half with somebody to really get to know them and what could be really causing these issues is just so amazing.
Yeah. Yeah. Our initial appointment for patients is 2 hours.
Wow. That's great. That's amazing. And so where do you see yourself, moving forward?
That's such a good question. Honestly, I love seeing patients one-on-one. I
Yeah.
see myself staying in that space, but I also love educating, right? Like
Hmm.
taking me back way back to the undergrad degree. A lot of that stuff is educating,
Yes.
understanding how to help people change the way they think, because
Yes.
yes, I can work on an individual scale, help people see their own, deficiencies and what's going on in their body and correcting it. But there's another part of me that would just love to get into like a university classroom, get into an
Yes.
undergrad classroom and, teach the masses and students that are even not in healthcare or even nursing schools,
Yeah.
teach future nurses how to think about things functionally.
Yes.
Because the second that you start to help and you open people's brains to this way of thinking, it changes the paradigm and it shows you that yes, Western pharmaceuticals, Western med, that's so important and it's there for
Hmm.
you. An emergency, please call Western
Yeah.
medicine,
Yeah.
not functional.
Yeah.
But it also like really helps you start to think outside the box. And it also taps into that piece of medicine that's an art, not a science.
Yes. Yes. Oh, I mean, you would be an amazing teacher. Because you break things down in such a way that it's like, oh my gosh, that really makes sense. Because this is super complicated stuff. I mean, this is not really things you can drill down into a nutshell very easily, but you've done a great job of explaining, the work you've been doing and the work that's going on in this area of medicine. And it's really incredible. I'm excited for you.
Thanks. Yeah, I love it. I feel like it's funny. I'm 31 and I feel like I'm truly just starting.
Yeah. Yeah. Yeah, that's amazing. Well, yeah, I feel like you've lived a lifetime in your in your I won't even say short nursing career because it's been a while, but I think maybe because you had that experience early on in your young 20s, like you just were able to grow so much from that so quickly and you had such a clear path on where you wanted to go.
Sure. And I think, I don't know if all nurses feel this way, but I did feel that pressure of like, you need to work hospital, you have to work ICU, you must get those years of experience. And honestly, as much as I learned in the NICU, as much as, I use those skills in every patient that I see, like there's no part of me that felt like that was my calling.
Yeah. Thank you for calling that out because I,
Mhm.
I I do think nurses feel that pressure, and I know several personally that have bounced around in a bit, and they feel like guilty. I'm trying to think of the right word. They feel like they can't, like they're not finding their place, and they feel bad for abandoning their coworkers or trying to shift and find the job that works for them. And I'm like, no, just keep it because you're not feeling settled because it's not the right spot for you. Keep looking, keep going.
Yeah, the
Yeah.
two things I would say, like it's almost twofold. Part one is if it's not right and your gut's telling you it's a no, then get out of there. Like
Yeah.
it's not where you're meant to be. Like no one's going to advocate for you. Similarly as a patient, same goes as a nurse.
Yeah.
No one's going to look out for you. No one's advocating for you but you. So you have to find a place where you feel like wanted, valued, appreciated by not only your institution or your boss, but also by your patients. And
Yeah.
if you're not there, get out.
Yes.
That's part one.
Yes.
And then part two is know that if you feel like you're stuck or you're in a situation, I promise you, I am the most thankful for that my NICU job and my first job in functional medicine that felt like a residency, because I utilize those cases, those scenarios, all those skills every single day. So it's not like you can just like make the jump to where you want to be without
Yeah.
some of your stuff underneath. So they're both true.
Yeah. Yeah. That is such a good reminder too about just that your journey is your journey for a reason. And even in those hard seasons, especially if you're super sick or in a lot of pain or really suffering, it feels really crappy to feel like I have to go through this to get to where I'm meant to be. But that's the reality in most cases is we're going through that hard time because it's something we need to learn, or maybe even something that we need to grow into to share with others.
Absolutely. Could not agree more.
Yeah. Oh, I love it. Okay, you have just shared so much good information, and I'm starting to kind of wrap us up. And so I want to see you've shared literally like I think you already put the bow on the topper, but I want to see like is there anything else on your heart that you would love to share? My audience is mostly nurses, mostly women. Is there anything on your heart that you're like, this is what I need to make sure you hear it today?
Honestly, yes, but it's not about me or my journey. It's
Yeah.
about like supporting yourself as a nurse,
Yes.
because a lot of what I do is helping people, like, again, recalibrate, reframe, look at themselves and their lives really differently for longevity. And nurses
Mm,
traditionally in the hospital are not set up for success. It's 12-hour shifts, it's night shifts, it's, sacrifice yourself in the name of others. And my invitation is to start to invest in yourself. And the way to do that from a functional lens is make sure that you are getting like at the bare minimum, good omega-3s, vitamin D, a B complex vitamin for all those B vitamins, glutathione for detox,
mhm.
and you don't need to be on 100 supplements, but at least giving yourself those foundational nutrients that are going to help your body, your cell signaling, your cell cycle, your Krebs cycle, hello biology, all of
Yes.
that stuff function so that you can continue to show up as you're navigating this journey, as you're showing up to other people. And yes, lifestyle, sleep, stress, nutrition, all of that's so important. And our food is made like crap in this country,
Yeah.
and you do need to sometimes lean on high quality supplements. And as a nurse, I'm pretty sure nurses can do this. If you go to
Okay.
fullscript.com, it's a supplement store where
Oh,
every single supplement is third party tested, which means it's gone to a factory for purity and quality, because the FDA doesn't regulate supplements. So like
right.
if you go to CVS or Target, that could literally be cornstarch. So don't buy your supplements from there.
Mm.
Um, but you can go on FullScripts and upload your license, and I'm pretty sure you'll get wholesale value on medical grade supplements.
Oh, that's
So that's
great.
something that I would do. I would just
Okay.
start to, familiarize yourself with these brands, with what's in them. And like, I promise you, like, it will change the foundation of how you feel.
Amazing. As I'm like about to go Google that and check it in because I need to reorder some of my supplements. So I might as well make sure they're of good quality. And if I can get them more reasonably priced, that's even better too. Yeah.
Totally. Yeah.
Awesome. Savannah, where can people find you?
Yeah. So my Instagram is Savannah Young FNP. It's a catch-all. I'm not like an Insta famous person by any means. I'm very real. I post the
Love
ins,
it.
the outs. I'm not consistent, but I will check that. If you message me, I will respond.
Perfect.
That is my main kind of spot. And then savannahyoung.com is my website. I do host retreats. My next one I am thinking for the fall. It's like functional medicine, yoga, all that
Neat.
stuff. So yeah, Instagram and my website are probably the two best places to find me.
Perfect. Well, I'll be sure to put that info down below. Thank you so much for your time today. You have really kind of like opened up my eyes, a little bit of mind blown moments. I'm like, I need to go back and research more of that. So
Oh my
thank
gosh. Well,
you.
thank you so much for having me. And I really admire the work that you do. And I think it's so important that, nurses see other people's stories, because
Agreed.
you can feel so isolated. So
Agreed.
thank you for
Oh,
what you do.
thank you. I gratefully accept that. And it's pretty awesome. I love doing this work. Yeah. All right. Thanks everybody. We will catch you next time. Bye.